Hi, I'm Dr. Eli Tabari, and today I'm here to talk about TMJ disorders. Now, a lot of patients come to me and they tell me that they have TMJ. TMJ stands for temporomandibular joint, and what these patients probably mean is that they have a temporomandibular joint disorder. Now, what this involves is either pain in or around the temporomandibular joint, functional limitations of the joint, or a popping and clicking that is heard every time one opens or closes their mouth. Let's discuss this last symptom first. Now, 30% of people in the world have this popping or clicking every time they open or their mouth wide or close. And this is scientifically described as internal derangement of the joint. So, let's talk about the anatomy of the TMJ. The basic components of the TMJ are the following. It is made up of the condylar head of the lower jaw, the base of the skull, and there's a disc in between these two bony structures. Now, for various reasons, in some people, this disc gets moved forward. When it does get moved forward, when the patient has to open their mouth wide, the condylar head of the mandible has to push against the fat part of the disc, kind of like how the tires of a car have to go over a road bump, and that is why you hear a click or a pop. And then, when you close your mouth from this position, the condylar head has to again go through the fat part of the disc, and another reciprocal click or pop is heard. And this is described as internal derangement of the joint. Now, the fortunate thing is, of those 30% of people that have this condition, only 10% have painful symptoms. And that is when we start to treat this disease. However, unfortunately, as luck would have it, this disc is not the only source of the temporomandibular joint that could cause painful symptoms. There's also internal components of the joint itself that could cause pain. The ligaments, tendons, and capsular attachments of the joint that could cause pain, and the muscular of the facial region in the area of the joint that could cause pain as well. So what are some of the treatments for temporomandibular joint disorders? Well, we initially start very conservatively, and this may involve applying warm or cold compresses to the temporomandibular joint, or massaging the area of the temporomandibular joint, or avoiding hard chew foods to relieve stress on the joint. Also, avoiding excessive talking. Now, this also may help people in their personal relationships. Also, it is good to be cognitive of situations that can be stressful on the joint. Now, for me, that's hard because I'm an LA Rams fan. No! Other recommendations include physical therapy to the temporomandibular joint, which involves jaw exercises. Also included in the recommended therapy is ultrasound therapy. And another component of the conservative treatment protocol is the fabrication of this device, a temporomandibular joint splint. Now, this device can help with something I have termed JOINT, and that is an acronym which stands for joint stability, optimal muscular function, interocclusal disarticulation, neuromuscular reflex stability, and teeth protection. All those things can be helped with a simple device like this that needs to be custom made by your dentist or dental specialist. So we allow about 2 months for the patient to follow all those recommendations, and we see if their symptoms have improved or not. Now, for a lot of people, their symptoms do improve, which is great. However, for certain people, their symptoms do not improve, and sometimes they might even get worse. Unfortunately, there is no magic bullet treatment for these people for their TMJ condition. It's a gnawing, chronic pain condition. Now, why is there good news for these people? It is because there was a study done by Boring, which followed 99 patients for a span of 30 years. Now, this study by Boring gave some pretty boring results. The study by Boring gave some pretty boring results, but that is what you want in a chronic pain study. He essentially found that for those 99 patients over 30 years, they were treated without surgical therapy, and their TMJ symptoms either stayed the same or improved.
What's wrong with some patience and true grit and hard work when I was your age?
No, pain is pain. And if the conservative treatment modality doesn't work for certain patients, then we have to resort to a little bit more invasive therapy. And those include the following. Basically, one of the treatments is injecting steroids into the joint. Now, another treatment involves washing out the joint. Now, how you accomplish this is you put 2 small needles into the joint. In one of the needles, you administer normal saline, and the other needle collects this saline that has went over the joint, and in a sense, it's washing out the painful mediators inside the joint. Another therapy is actually Botox therapy.
Yeah.
Botox therapy not only relaxes the muscles in and around the joint, but it also inhibits the substance called substance P, which is a painful mediator. Now, if all these treatments fail, then we have to even go through more invasive surgical treatment. And some of those include removing or recontouring the disc of the temporomandibular joint, or cutting the back half of the lower jaw to put less forces on the temporomandibular joint, and at the last resort, reconstructing the TMJ apparatus with prosthetic devices. So in summary, temporomandibular joint disease is a complex disease, and treating it involves a complex set of treatments, starting initially with conservative treatment and then following through the spectrum of more invasive treatment. However, major surgery for the temporomandibular joint is only reserved for those cases that do not respond to conservative or minimally invasive treatment protocols.